O in outside stands for
알겠다. 이거네.
Shivan here. Today we are going to talk about benzodiazepine metabolism. Be familiarized with the name of the drug benzodiazepine. You remember the benz, the mark is on the digest cookie. Koreans pronounce bench, bench, as a bench on digest cookie. I'm going to explain the details of the metabolism process after the mnemonic. To begin with, most of benzodiazepines are metabolized by the liver, especially the enzyme whose name is cytochromosome P450, or in abbreviation it is called CYP. And diazepam is used to calm a patient, so it is a calming drug. So please remember this mnemonic. CYP metabolizes a calming drug. Repeat after me. CYP metabolizes a calming drug. So now match the letters with the drugs. M in metabolizes stands for midazolam. A stands for alprazolam. C in calming stands for clonazepam, chlordiazepoxide. D in drug stands for diazepam. M for midazolam, A for alprazolam, C for clonazepam and chlordiazepoxide, D for diazepam. And there are exceptions. These benzodiazepines are metabolized outside of liver. These diazepines, which undergo extrahepatic metabolism, are useful for the patients who have liver dysfunction. I will share you details of it in a while, after the mnemonic. So just to remember outside the liver, to remember benzodiazepine which undergo extrahepatic metabolism. O in outside stands for oxazepam. T in the stands for temazepam. L in liver stands for lorazepam. O stands for oxazepam, T stands for temazepam, L stands for lorazepam. So now we will see how these metabolisms take place. There are commonly known two phases of drug metabolism. Phase 1 usually takes place in the liver, and other organs like intestine, kidney, and lungs also participate in drug metabolism, but only in small portions. Cytochrome P450 is the key enzyme in phase 1. These enzymes oxidize, hydrolyze, or reduce toxin into metabolites. In this process, it makes a toxin or drug makes more polar and water soluble. So from the mnemonic, CYP metabolizes a calming drug. These drugs need to undergo phase 1 to be more soluble. However, those drugs from the mnemonic outside the liver, lorazepam, oxazepam, and lemazepam, they already have hydroxyl group, so they don't need to undergo phase 1. That's the reason why those drugs do not need to undergo hepatic metabolism. In phase 2, conjugation molecules bind with phase 1 metabolite to make it more soluble. These binding works are done by this transferase. In this picture, the R is the metabolite and the leaf is the conjugating molecule. So this transferase attaches the metabolite with the conjugating molecule to make it more soluble. So this attaching process is known as conjugation reactions. So those highly water-soluble molecules which make the metabolites more soluble are methyl group, and attaching the methyl group is called methylation, and acetyl group, and putting acetyl group on the metabolite is acetylation. Sulfur group, sulfation. Glutathione, glutathionylation. And lastly, glucuronic acid is attached, and attaching glucuronic acid is glucuronidation. So all these molecules love water, super hydrophilic. So wherever the water goes, they follow. That is the reason why drugs are excreted through urine, because the blood is filtered and the water is excreted through urine, and the drugs are also saying bye bye. And I say also bye bye.